Hello, our Q&A for this month is a question that I'm being asked more and more about, and that's on this topic of traumatic brain injury. What can be done using herbs, for example, to help someone who has suffered from traumatic brain injury? Now, this might be due to a stroke, or it might be due to an automobile accident, or maybe a sporting accident. For whatever reason, the person is suffering traumatic brain injury. Is there something we can do with herbs? And the answer is yes, there is. Now, there haven't been very many clinical trials in that regard, and I'll talk about a couple. Um, but there's a huge biological plausibility behind what I'll be proposing. And do we have to wait until we got the clinical trials when there's people in desperate need and we know the herbs will certainly, at the very least, do no harm? So I'm going to first begin by talking not about a herb, but about omega-3 fatty acids, specifically long-chain omega-3 fatty acids. Of course, they're found in fish oil, but we also get them these days from algal oil, and that's especially suitable for vegetarians and vegans. So in that sense, it is kind of a herbal product in that it's made from algae. And we have other herbs that come from algae, like seaweeds. So this paper, which I think you can see flashed up on the screen, this paper talks about a case series of 9 cases of omega-3 fatty acid supplementation in severe brain trauma. And you can see Julian Bales and Barry Sears, first and last author, and they're the principal players in this. And they're arguing that we need to now do a large clinical trial because the benefits from this case series are so outstanding. It does need to be fairly high dose, but the results are outstanding. So omega-3 fatty acids. Now, in terms of herbs that have been used in clinical trials, there is this study that was done using a whole extract of licorice, which looked at neurological improvement of patients after acute ischemic stroke. And the authors concluded that there was a beneficial effect of the licorice in neurological improvement of the patients. Now, I think as well as ischemic stroke, this can be extrapolated to any kind of traumatic brain injury. And it's probably largely the flavonoids in the licorice extract that make it so black in appearance that could be giving this benefit. We also know that in China, especially, they routinely in many hospitals give ginkgo biloba post-stroke to encourage recovery. And you might be thinking, oh, ginkgo's blood thinning, won't that make a stroke worse? Well, ginkgo's not blood thinning, and no, it doesn't make the stroke worse. So they're 2 of my key herbs now: licorice, watch for blood pressure effects, of course, from the licorice, and ginkgo biloba for any form of traumatic brain injury. Now, what to do next? Well, we want the brain to heal, and there are various trophic factors that the brain produces to enable this process. We also want to get, if you like, a kind of neuroplastic brain healing. So are there any herbs that have been shown to improve brain neuroplasticity per se? So let's answer the first question first, and that's brain-derived neurotrophic factor is exactly one of these factors that supports brain tissue and helps it heal. And in clinical trials, bioavailable curcumin, St. John's wort, bupleurum, and ginkgo, and I've already mentioned ginkgo, have been shown to boost circulating brain-derived neurotrophic factor, BDNF. If we look at herbs that have been shown in clinical trials to enhance neuroplasticity or neuroplastic responses to inputs, we find that there is one such trial, and it's called Bacopa. It was a trial done by researchers who are Australian-based, Bacopa, Moniera, and it gave results on brain imaging studies that suggested neuroplastic effects. So we need to add bacopa to that mix. Also, traumatic brain injury, of course, causes an ongoing neuroinflammatory response. And for that, we have a couple of key herbs. Again, the bioavailable curcumin and the boswellia. I believe they're both frontline for reducing neuroinflammation. If there's still some pressure happening in the brain, well, we could consider horse chestnut. Now, horse chestnut contains the active component esin. It's a saponin group, a mixture of saponins. And in Germany in the 1950s and 60s, they used to actually inject esin from horse chestnut into road accident victims to reduce traumatic brain swelling. So if there's swelling and pressure, the horse chestnut complex. The boswellia has certainly been shown to do that where it's inflammation driven too. People with brain tumours, you get pressure on other structures, and these people with brain tumours were given boswellia, and the neurological deficits caused by the pressure on structures in their brain reduced due to the anti-inflammatory effects of the boswellia in their brain. The effects were so profound that the FDA even proposed that the boswellia be investigated as an orphan drug for this kind of problem. I think also we need to get healing going, and one thing that's I think very important for brain healing is boosting the microcirculation. So the key microvascular herbs are, again, ginkgo, gotu-kola, grapeseed, but also I have my 5-point phytonutrient microcirculation diet, so that can be done as well. Then I think would see extra benefit on that microcirculation restoration / healing side and the healing of the brain tissue. So that's my summary of what I would do for someone with traumatic brain injury. Thank you for your question.